Hi guys, it's me again to give you more of my background and to learn who Zadie was or is or has been. And everything we do is gained by experience. So when we get older and wiser, we have to look back and see what did we gain from whatever we did. Well, back in high school days, I was a member of what was called the Footlighters. And the Footlighters is a group of people who put on plays in the school, and we started that in junior high, and they continued that in senior high, putting on at least one play a year. And I really enjoyed that. It was scary. Remembering my lines was something else. I still have that problem today. And it was a lot of fun. During my high school years, besides sports, which I had talked about before, I was involved in what's called Boy State. And Boy State is once a year, all the schools in Wisconsin get together and send representatives to a location. In my time, it was Ripon, Wisconsin, where we discussed how politics works and we debated the politics of Wisconsin. And I ran for governor and lost. I ran for treasurer and won. So that was kind of fun, and it gave me some taste to the politics of at least the state level. I think at that time Wisconsin was Republican, and it still is. We had some lousy senators back there, and we certainly have a lousy senator today from Wisconsin named Johnson. I guess that's a bad name in different states. Anyhow, that was a lot of fun also. And when we went back to high school after that, we were able to talk to our classmates about Boy State and participation. Along the same time, I was a Boy Scout, and I became old enough to become an Explorer Scout. And I don't know if I said this before, but my first Explorer Scout experience beyond the locality where we lived was to take a bunch of Boy Scouts on a camping trip. And we went on to Ontonagon, Michigan, which is in the northern peninsula, and it happens to be iron country. And it was my job to be the leader of the Boy Scout unit. And while we were there and camping, I took a bunch of Boy Scouts out on a hike. And I took my compass with me so that we could find our way back, because coming back was going to be dark. Well, coming back, it got dark, and I took the compass out to see where we were, and it went around and around and around and around and around and around, because we were in the middle of iron country. So the iron in the soil was acting like a magnet, and the compass couldn't decide where to go. And I was scared out of my pants. But little by little, we got the scouts back to the camp, and I never went camping again. Well, I've gone camping, but I stayed in motels and hotels and stuff like that. Anyhow, that was my experience back then, and I never became an Eagle Scout. I just felt that it wasn't for me. Later on, I got into politics and medicine, and that's when I got involved with the Joint Council of Allergy and Immunology, and this was a umbrella group for the Academy and College of Allergies, and it was primarily involved with social and economic affairs. And in 1986, I became president of the organization, and during that period of time, during my presidency, we developed what's called the RBRVS system, and I was one of the 80 doctors in the country to put together the whole system of understanding relative value scales for charging patients or insurance companies or whatever for the time involved on whatever. As an example, we had to decide how does hay fever match with appendicitis? So the surgeon doing his job and we doing our job cognitively, does that match, and how do we put it together? Things of that nature. There's all kinds of mathematical formulas that were used, none of which I understand today, but back then it seemed to make sense. But over the last 50 years, things have changed a bit, and the RBRVS system that we set up has also been modified, and probably for the better. Because today, instead of saying your diagnosis will determine how much you get reimbursed for, it's how much time you spend with the patient for whatever problem they have. So a person who's having emotional problems, which take more time, can be just as rewarding economically as a person who has a major disease entity. So things have been modified, they are changing, and over the last 50 years, medicine has changed. When I first got into medicine and into care for allergy and asthma, we were having 10, 12 patients in the hospital every day because of asthma. Today, we probably only have one patient per year. It's become an outpatient practice because the medicines have improved. The diagnoses have tremendously improved. As an example, 50 years ago, asthma was asthma. When I entered the asthma treatment program, we went over the number of patients who died because of the treatment for asthma. Today, it's not a common event at all. Medicines have improved to the point where we even have biologics that block asthma from occurring. Instead of one course, one disease ended the asthma, we have at least 6 or 7 different types of asthma. So things have changed. And that's my lecture for today. And I am happy to talk again later.